The FDA just approved the use of a new drug that slows the progression of Alzheimer's. We're joined by dementia specialist Dr. Danielle Goldfarb to find out exactly what this is and a program who might be eligible to be taking part in this study and some really significant advances that have been happening. I mean, this is just a devastating disease.
It is a really, really difficult disease, and it goes on for many years often. And I care for patients and families at Banner Sun Health Research Institute, and we're involved in lots of clinical trials. And this drug that was just approved is called lecanemab.
Okay.
And it's approved for individuals who have the mild stages of Alzheimer's disease, confirmed with biological changes in the brain of these abnormal proteins.
Okay.
Now, recently, over the past decade, really, we've made major advances to diagnose Alzheimer's disease during life, and we're at the point that we have blood tests that can accurately diagnose Alzheimer's disease during life and even before there are any symptoms.
Wow.
And most people don't know this, even lots of healthcare professionals don't know this yet.
So if you've got a family history of this and you're concerned about it, and obviously as we so much is lost in the quality of life. I mean, families just are devastated when they have somebody living but they've essentially lost them, it feels like. So if people are concerned about this, insurance probably doesn't want to cover this all the time. How would somebody go about getting themselves identified and figuring out if this is something they want to be, proactively working against?
We have a clinical trial called AHEAD that's going on to study this drug lecanemab in individuals who do not have any symptoms of memory loss or cognitive changes, but we detect these Alzheimer's changes in their brains. And this is for anyone 55 to 80. And as you mentioned, often people with a family history are those that are calling and coming in. But anyone who has any concerns, it's really important to find out early. And what's great about this is that we have a blood test is the first step in the screening process for the study, which is so easy. So you find out if you have this elevated protein or not. And then if you do, we continue moving forward with the trial if you're interested.
So is that a marker that is kind of with you for the course of life, or is that something that would come on and be changing in your body chemistry as you age?
We've learned that the Alzheimer's proteins start building up 20 years before any symptoms of memory loss. Really, and so midlife, which I define as maybe starting at 45, is really when this should be on our radar. And I would add a plug for exercise. Aerobic exercise is important, especially in midlife, and it seems that that slows the risk of dementia 20 years later.
Wow, fascinating. It's fascinating for you, I'm sure, to be in a field where you're actually seeing progress being made, and I mean the results of being able to make any level of improvement in the quality of life is just so important and valuable to society as a whole. Even more interesting about this trial would be that this drug is already determined to be safe and effective for those who are experiencing this. So now you're just focusing on, can it prevent the symptoms altogether?
This is really the tip of the iceberg, and we do have so much to learn, but the advances made with this drug for the early stages of disease are absolutely significant, and there's still a lot to move forward with that in terms of learning if Medicare and other insurers will pay for that. But we are now looking at, we really need to get to this disease before any symptoms. Just like, for example, with cancers, we do our cancer screenings to catch it before there's any symptoms and get right into treatment, and that's where the Alzheimer's field is moving.
Okay, so doctor, we'll put the information on AZ Family, but right now you want to contact your hospital and research facility if you want to be involved in this, okay? And then otherwise, separately, if you're just doing a well check with your doctor, what should we be asking?
You could just be asking, is it possible that I have Alzheimer's changes building up in my brain, or I have some concerns that I have memory loss. Is this normal for aging? Can you do some more tests?
Okay. Yeah, advocate for yourself. Thank you so much.